Good afternoon, everyone. Thank you very much for joining us today on this webinar, which is going to be an update around some of the things that have been going on in the world of COVID. And certainly we're having a presentation from the department, from Stewart Lowden from the department, to give us a few updates on what's going in the meat exports branch. So we've made a slight change due to availability. So Stewart will be kicking us off, and then Ian will be joining us later on to give the rapid antigen presentation, the rapid antigen testing and COVID presentation. Just for a bit of housekeeping before we start, if you've got any questions, please type them into the questions part that you've got within your little toolbox there on your screen, and that'll give us an opportunity to ask questions probably at the end of each presentation. What is happening is that this is being recorded, and so a copy of this will be able to be provided post, in the days following this presentation. So thank you very much to everybody, and I will hand over to Stewart to kick us off. Thanks, Stewart.
Thanks, Amanda. Have I got full screen there? Can everyone see that?
Yep, you certainly do.
Great, thank you. Well, look, thanks everyone for the opportunity to talk and just give you an update of where we are in this second half of 2021. The things I'd like to discuss today, give you an update today, are as listed on the slide there: the AAO transition, MSAP audits, MSAP being Export Meat Systems Audit Program, the cessation of OPV monthly periodic audits, or MPA, loadout policy, shipping marks, electronic certification. Just a very brief introduction, and just a notification of the 2 meat notices that have actually been put out this year. So first of all, if I could just give a bit of a rundown on where we are with the Australian Accredited Officer, or AAO, transition. As you know, possibly know, 32 establishments were impacted by this change in inspection. This was a budget announcement as of the 6th of October 2020, 32 establishments. If we break that down, 9 of these are single FSMA establishments and won't change their current inspection model. 15 establishments have transitioned, and of the 8 establishments that haven't transitioned yet, 1 is of a view that transitioning doesn't suit currently their individual circumstances. Remaining 7 have indicated a transition date by the start of January 2022. And of course, we are looking at amendments to the export control meat and pre-product rules, the relevant rules. These are going to be implemented from the 1st of January 2022. It allows the inspection reform policy to be embedded in the legislation, which will ensure that the remaining establishment will undergo that transition. The second thing I'd like to talk to you about is audits. MSAP audits, Export Meat System Audit Program. This is the plan that we have in place. The implementation policy is currently in development, but actions have already been taken. We are going to a 1 auditor policy. Under COVID, you would probably remember and realize we actually had 2 auditors on plant. We're going back to 1. We're also moving to 6 monthly MSAP audits for those establishments that have not yet converted across, and proposed eligibility for annual risk-based MSAP audits. First of all, taking a look at the 1 auditor policy. This auditor, the ATM, for want of a better terminology, we're going to call the MSAP ATM. From the 1st of November this year, the 1 auditor policy will apply at all export registered meat establishments. The other auditor, the other ATM that's involved on plant is called the resident ATM. They will not be involved in the audit at the establishments, but they do have the day-to-day responsibility for those establishments. So this maintains audit independence. We have an MSAP auditor, comes in on a 6-monthly basis, but we have a resident ATM that actually looks after day-to-day responsibilities. The ATM conducting the audit, the MSAP ATM, will not have a role in approval of the establishment AA, and will not have a role in the technical supervision or technical support, probably a better term, of the on-plant DAW team. The MSAP ATM, the person who's going to come in 6 monthly, is probably going to be for a defined period. It's been brought up at about a 2-year period until you look at a potential changeover of that person. So let's have a look at the resident ATMs. The resident ATMs are going to be the departmental contact for establishment run. They will be responsible for dealing with possible variations, along with the operations team, which is also going to include on plan. The importance and predictive and the on-plant vet.
Hello, Stewart.
And critical incident investigation, and they're going to fire on-plant management system. Now, the confirmed transition to on a monthly audit basis will be required to transition significantly. The audit responsibility is going to be, yep.
You're kind of patchy at the moment, Stewart.
Still being of a bird. Oh, am I? Okay. I've got the best reception I possibly can. Is that clearer?
You're clearer there now. Thank you. That's perfect. Thanks.
Okay. Is that a bit better? Okay. Apologies for that. I'll do my best to speak up maybe a little bit. We've got 6 monthly MSAP audits. We know that we've currently got 2 types of ATM, or they're going to be in place. It's going to be the resident ATM for the plant and the MSAP ATM. 6 monthly MSAP audits. It's pretty much going to be the same. Remote documentation is going to be in the review, scope for that still. On-site verification, of course. And it's going to be an unchanged process. All the approved arrangement elements audited within a 12-month period. Critical elements included in each systems audit. The duration is going to be continued to be influenced by things like establishment complexity, level of compliance observed during the audit, and the organization and audit preparedness by the establishment. And of course, an exit meeting and a draft audit report produced, and a later final report on review by the form as well.
Yes, no, I was still stuck on the DFAT thing till exactly half past.
Okay, but that's fine, that they missed you coming in.
Right.
And then they said, if you want you, so.
No,
Sorry,
yeah.
Christine and Ian, you're not muted.
Okay. Yep, sorry about that. Happy to continue. MSAP audits, 6 monthly MSAP audits. The resident ATM will not be involved in the conduct of the system audit. The resident ATM and the OPV, however, will be responsible for verifying the establishment CARs that happen in response to what the MSAP audit findings are. Now, MSAP audits. We have this proposed eligibility or eligibility criteria for annual risk-based audits. And what we see is this is an establishment with a mature, approved arrangement with sustained, consistent compliance. So this is in development. We have an implementation policy in development as I speak. So what are those eligibility criteria? They're going to be previous systems audit performance. So there's going to be a requirement for an acceptable audit rating from 3 previous 6-monthly audits. There's going to be no recent history of critical incidents in the past 12 months. And a critical incident is defined in the critical incident response guideline that can be found on ELMA 3. Participation in all departmental process control monitoring verification programs and a need for ongoing evidence in that regard, as well as certified compliance with the Global Food Safety Initiative. And again, ongoing evidence. And you can see that there are a few safety schemes there, audit standards recognized by GFSI. Certified by OSMET as compliant with the requirements of the Australian Animal Welfare Certification System, and of course, ongoing evidence there. And the last one, which has caused some discussion that I'm aware of, the establishment must utilize electronic product integrity systems and provide data generated on request, such as an AMPC. Now, we are aware that there may be some inconsistency with our meat notice that's actually on ELMA at the moment in regard to mandating AMPC, but I think going forward, the forms are very keen to stress that in order to actually push out to a 12-month audit, there has to be some electronic product integrity system in place, and the AMPC is the one that we are really focusing on here, and we're going to go forward and develop that and work with industry to make sure that we roll that out appropriately. As far as new establishments are concerned, or those that may be extending from Tier 1, the implementation policy is to start with monthly audits for a 6-month period, then apply for transition to 6-monthly audits, and thereafter, once the you have 3 of those in a row and they've all been acceptable, then they will probably be moving to looking at an application for an annual risk-based audit. Cessation of OPV monthly periodic audits. So the OPV actually puts in place a periodic audit on a monthly basis. And the reason for this is that in the past, the monthly periodic audit was required under old legislation to allow departmental officers to issue CARs. However, the Export Control Act, the new one, allows departmental officers to issue those CARs outside of an audit. So there is no longer any need for that MPA between the MSAP 6-monthly audits. And time to implementation. Well, we're working on the 1st of January 2022 for this because there is a lot of work instructions and policies that need to be altered to reflect this change in moving away from this. Loadout policy. Now, this one has actually caused a lot of discussion both within government and within industry, and we have been working closely to try and get this right going forward. Under the Export Control Act and the rules which commenced on the 28th of March this year, there was a new legal framework, and some may remember that there was actually changes brought into loadout policy. The department is now progressing these amendments to some of these rules with a change likely 1st of January 2022. And there is an amendment in there that has been worked through with interested industry to AMIAC for consultation to clarify this supervision of loadout that we actually have. And in short, and I've worked closely with this, the proposed procedure resembles, but is not identical to the procedure that operated under the old meat orders. And so what we've done is we've tried to keep all the best elements and then try and improve what we actually had. So this is an example of the schematic that's associated with the draft policy at the moment. So we have an activity, we have a responsible role, and the role requirements. Many of you will see that the activity is actually very similar to what existed in the past. Loadouts of goods, export verified, a notice of intention to export, an application for an RFP, a declaration of compliance for the export permit application, which used to be a validation, but validation is not really the appropriate word. So we moved from RFP validator to declarant, and then the export permit is issued. What the major changes are here is in the new rules as they exist currently, the person supervising or directing loadout has to be in management and control, and they have to provide a declaration. We have removed that need for a declaration at the supervising or directing loadout of goods, and that person doesn't need to be in management and control. The declarant, of course, requires approval for XDoc and is a position of management and control, which we believe resembles what we had before. And this is the non-EU policy. For EU and UK, there's no current change. The Export Standards Branch believe that there is no appetite to look at anything different at the moment. And so we will maintain the Departmental Authors Officer, the on-plant vet, validating RFPs for Europe and the UK. Shipping marks, and I know that there's been quite a lot of...
Sorry, Stuart, can I interrupt there for a second, please? I apologise for this, but, but Ian has actually another meeting at 2:15 our time, 1:15 Brisbane time.
Okay.
So I was wondering if he could. I know it interrupts your flow, and I apologise profusely for it. But
no, that's fine.
Do you mind if he jumps on? If he jumps on now and does his part of the presentation, and we come back to shipping marks?
That's fine. We'll come back to shipping marks. Now, what do I do to get out of here? I just actually just.
I think Amanda will make. She made Ian. Yep, there you go. Ian Norton is now presenting. I'll hand over to Ian Norton. I apologise for the disjointedness of this, but thank you, Ian.
Hey, thanks, and sorry again, Stuart, for jumping in the middle of your talk earlier as well. Apologies for that. I can imagine. So thanks for the opportunity. No two things I wanted to discuss and really value some questions as well, or feedback, as Matt said on the chat line. A short synopsis on the COVID updates as we can see them, but really, I mean, all of you are getting all the media feeds and watching what's happening in your local and state and federal levels, so you'll know a lot of what I would discuss there. And then I want to discuss and maybe outline some things about rapid antigen testing as not a provider of particular test, but more of the system that you might want to look at to use it. And then very happy to take any questions about that. We'll be very frank about what is good and bad about using them for the meat industry. So first of all, on the COVID side, obviously we all know that the New South Wales and Sydney outbreaks are starting to settle a little. Whether that will continue or not, we're all watching for that 14-day plus time after reopening. And as gradually as things reopen, we do expect to get to a steady state of transmission in the community. that really is that overused term of living with COVID. So we're just a question now about what level that will be and how we pull levers to try and control intake into hospital for those who have chosen not to be vaccinated at this stage. In Victoria, obviously, we're very worried, like all of you are, on the increasing numbers. Really hoping that the vaccination rates start to kick in now, and we're seeing the very high uptakes. And congratulations to everybody who's working in Victoria and the meat processing side, because your rates are really going very, very well. Happy to take some questions on that if that's required, or offline. Realize vaccination and industry interaction with staff and things is still an ongoing issue, and so anything we can do to support, please let us know. I suppose the other thing to talk about is that the public health perception is changing very rapidly in those two states and also in the ACT, whereas there's still a bit of a slowness to change in the state health departments of Queensland, WA, Northern Territory, South Australia and Tasmania. So we're seeing a sort of a two-tier system, and as we gradually reopen some of those states, Queensland will be an interesting one in the next 6 to 8 weeks as things reopen here, where I'm based, because the Queensland Health directives will need to change. And what does that mean for you as a processor and an industry? Really, I'd encourage you to watch and still engage on the federal and state side, but very much chat to you, and I know all of you do this, with your local public health units, because there will be directives from the state level on how this transition change. We're in a transition change now when vaccination rates rise. Their perception and their risk assessment of you, as they've called us for so long now, a high-risk site. And I think that will gradually change. They'll still consider us high risk, but in these next couple of weeks, this is where we'll see how their perception of us will change because of our very high rates of vaccination, certainly 100% first dose, and then gradually as we get into that second dose, we need to be able to then justify that, say, all of our COVID controls have maintained through this transition period. Now we want to have an open discussion with each of our public health units in the local area and at the state level, what can gradually be withdrawn as a control, because some of those controls do affect our business, and then what other things could be added in. And that lets me segue then to this discussion on rapid antigen testing. First thing to say what it shouldn't be, and that is an option to not be vaccinated. That's kind of a negative approach to rapid antigen testing. It's not really designed for that. It could probably buy you a couple of weeks time, but really over the period after that, it won't be a long-term solution to continue to be tested forever and ever for the next 6 to 12 months rather than be vaccinated. That would not be a great option, and that's why you're not seeing that being offered at the state level for these mandatory vaccination approaches. But what is rapid antigen testing and why is it useful? Well, it is a very good measure of infectivity. So just so we're all clear and on the same page, rapid antigen tests do need to sample from your nose. It can be used from your mouth, but it's not. There are some products out there for saliva. They're not really that great yet. The evidence is still sketchy, but the evidence is strong for those nasal samples. Now, there are two branches or two ways you can do it. You can do the deep brain tickler, but you can actually use these tests with an anterior nose, just up about 1.5 centimeters or so into your nose. So much more comfortable, much more tolerated by staff. And this is what we are helping the Department of Health federally to roll out in aged care. So right now we are running a program over 410 sites or so in aged care to try and protect those vulnerable people by offering daily screening for all staff arriving and going to be treating those vulnerable older people. And you're now seeing, I'll just segue to say something about boosters, because you're seeing the federal government now indicate that older people will now be offered boosters, so will quarantine and healthcare workers, because we all know now 6 to 8 weeks or so, 6 to 8 months rather, after your vaccine, your immunity starts to wane. This has been found out now in the US, UK, Israel, Europe, etc. And we're starting to learn that same science. So there is a booster program for over 60s come in, and for those frontline workers. The question will be whether 1A also moves to meat processors, and that will have an implication for you. Will you be required to also look at booster shots for your people 6 months after their first and second shots? But it does mean that rapid antigen testing has a role as waning immunity starts to come in. But it does have an implication and a business cost. And so for me, and discussing this with many, many public health units, we need to understand, if you were to implement this, would it change their risk perception of you if you were to ever have a positive or several positives on your site? And that is a changing feast. There's different personalities involved in each of the public health units. Some of them have understood the science and understand that if you implement, that does decrease your risk, and that's what the science tells us. But some of the others are not quite on board yet. They've heard, you know, the push to continue PCR for a long period of time, etc. If I want to be very clear on that, PCR is great for diagnostic testing. That will remain the case in Australia for the next 6 to 12 months for sure. So if you're screened on rapid antigen test, you'll still require PCR to diagnose you positive. But we have lots of examples now from industry here in Australia who have not been shut down. I'm thinking of major distribution centers, huge courier systems that deliver the vaccines around the country for us and do all sorts of other important things. Lots of experience in aged care, at least 7 major outbreaks in aged care now prevented in the Sydney area alone by this process. And there are lots of other manufacturing and meat processing examples, both here and overseas, where they've managed to prevent outbreaks and continue to operate. And what's going to be interesting is whether you choose to do daily preemptive screening. That comes with a cost of at least $7 or $8 per test, and then the implementation cost of, versus do it twice a weekly. So the evidence between the two, you'll be about 96% surety, 96 to 98% surety if you do it daily on your staff. It drops to about 80%, 88% surety if you do it twice a week. It falls off a cliff if you do it less than twice a week. The reason being, incubation is about 3 to 4 days or so in Delta. And so if you do a test less than the incubation period, then you're going to miss a lot of people, and it's really not that worthwhile. Therefore, serial testing once a week or so, I would not recommend, but twice a week is an idea. If you choose not to have it at the front gate before the guys go through the boom gates and into your processing plant, you could instead look at another option for rapid antigen testing. And this is for discussion both with you as an individual industry or business, and interacting with your public health unit. Because if you were to implement this, there is a process we could advocate here, and that is to say, if I was to get a positive on my site, let's say somebody was infected by going to the local shopping center or whatever, or was caught up in a local community spread, and I know that they've been on my site, can I then immediately implement daily screening for everybody who was a close contact around that guy or girl? And then but they come in, I know who they were from my contact tracing list that you all have. I will implement screening for them for 7 or 14 days, but they all still get to go to work, and everybody else continues to work as normal. Now that would be a very interesting and useful implementation of rapid antigen testing, and I think there is a good chance that we can advocate that for the meat processing industry. They may choose to say no, not just the contacts, but the entire workforce for that next 7 to 14 days to make sure that it hasn't spread further than that one person. We'd have to look at the cost of that. But I think that's probably where we'll end up landing, at least in the interim. And then finally, you're already hearing messages about the 1st of November that TGA, the Therapeutics Goods Administration, will allow over-the-counter sales. Now, them saying that at a federal level does not mean instantly that it will be available at a state level. The state health departments will still have to assess that TGA recommendation and then have a process to be sure that you can safely buy that in a pharmacy, or you as a business could buy it and distribute it to your staff. But that is, I think, the new area where we will move to, where you can think about home testing rather than having a 15-minute process that has to be done in the car park or the boom gate. You can start to look at how you could implement this in your business in a healthy way, so that if I have, how am I using in the UK or the US or Europe right now? I can buy this over the counter. I can do it at home. I'm encouraged by my workplace to do a test if I have any symptoms whatsoever. Do not come to work, but do test yourself to see if it's not COVID. If it's COVID, please stay home. Tell your local GP or your local health authority that you have a positive antigen test, but stay home, get better. And when you're ready to come back to work, at least 10 days later, then come on back to work. That's how rapid antigen testing has allowed those other parts of the world to live with COVID, and it will eventually come here as well. But it's this interim phase that we need to talk openly about. Hopefully, I've captured most of the big ideas around it, but certainly the positives to this, it does come with a cost and also a business time cost. But the positives need to be that the public health department will decrease their risk assessment of a site and allow it to continue to operate throughout a minor outbreak. I'm going to pause there, Matt and Amanda, and see if there are any questions.
Amanda, are there any questions that have come through?
You're obviously answering all the questions there, Ian. Thank you. There hasn't been any questions come through, but if anyone wants to send one through, feel free to type it in your toolbar.
Maybe while that's coming, guys, I might very quickly say about the, how tough is it to implement, and some of the lessons we've learned from working with lots of manufacturing, banking sector, professional services, and the meat industry. The supplier of a test, so you can choose to go out and buy a test, and certainly from the 1st of November, it'll become even easier to buy those tests. But the test supplier will give you a little video of how to stick it up your own nose and do the test. That's a tiny part of the bigger question. How do I actually implement it as a business? That's a different set of discussions. So that's really where we step in to support, and that's the how does it embed in your existing COVID plans? How do you implement it? How do you report it? How do you make sure you've got your consents lined up, your actions on a negative and a positive, and what to do if you ever get a positive screen at the front gate? And it allows you to then take an attitude towards contractors and visitors and all the other people who come in and out of meatworks. We're also expecting, and this is the 1st of November change, that this medical supervision requirement will drop away. Now that will drop away very quickly in New South Wales. I know that that state has been pressuring TGA to change that rule for some time. They don't want it anymore. They want to be able to use this at an industry or a home level just by individuals doing it themselves. They don't need a nurse or a doctor or paramedic to watch them. So New South Wales will grasp it straight away. So those of you with plants there are in a good position. I think Victoria will move quickly on that because they're just physical numbers of 2,300 per day of new cases. They just won't be able to keep up, and therefore they want their doctors and nurses working in hospitals, not in these sites. Queensland may step in a little later, but you may see them transition over a number of weeks or months.
Fantastic. We do have a question from George Korniatakis, and I'm sorry if I pronounced your surname wrong, incorrectly, George. But what training is required to administer the rat testing on sites? So
thanks, Joshua. The question is good because in that rollout package, the training really will be even when they change their rules about not having a nurse or doctor supervise. So that's the person who used to have to be trained by the supplier or by us. And they were the super user watching 15 or 20 people at a time moving through. But the future will show that training for that COVID marshal or whoever else you're going to use as the person who watches people perform the test, that there will be an intensive set of videos and things they have to watch, and a little bit of training. Lasts for us about 60 minutes or so it's not hard. There's some great papers out there that show if we do that for 30 to 60 minutes and train somebody up, their rates of performance match somebody who's been doing it for 6 or 12 months very, very quickly. So there's no real change. Super easy test to do, but you do need to go through a 30 to 60 minute thing as a super user. Then we're working on a very simple app to train a general staff member, which will be a much shorter thing, 10 to 15 minutes maximum.
Thank you. I've got a question, Ian. There's obviously probably the opportunity for a large market of rapid antigen testing has probably opened up for a lot of people who in this diagnostic space. Now it can be quite confusing potentially for someone as to what to purchase. Is there a location that people can go to find out the list of I suppose suppliers that the TGA is considering?
So that's a complex question because there's at least 25, that's probably an old number, it's more like probably 30 at this stage, suppliers that have presented their tests and their evidence from another country to the TGA and been approved to supply here in the country. So it's a huge list to choose from, and it's very confusing, and there's price points I've heard as low as $4.50 to as high as $15 to $16 at least, maybe a bit more. So what's the good and the bad in there? Now, I'm never going to say the trade names or talk about that over this kind of webinar, but definitely we do assist groups to look at the evidence, and we weigh that up very carefully, and they're not all the same. There's also been some things that unfortunately the TGA do not publish, but state public health labs in New South Wales, in Victoria and WA, and we've had a look at their studies, have done some independent assessments of those suppliers, and they've chosen the top 5 or 6, which are the ones that we would advocate for as well. There are others that aren't coming from the same countries, don't have the same processes behind them. They're TGA approved, but they really may miss a lot more people than the stronger tests. So I think there's 5 or 6 front runners that I would recommend.
Yeah, thank you for that. Amanda, has anything else come through from a question perspective?
No other questions have come through. Thanks so much, Ian and Matt.
Okay, so Ian, thank you very much. We know you're a busy man. Certainly got your fingers in a lot of different pies as industries that you're helping out, and so we thank you for you taking the time out to speak to people here on today's webinar.
Thanks, guys. Cheers.
Thank you very much. Okay, so thanks, Ian. And while we're changing over presenter back to Stewart, again, thank you very much, Stewart, for allowing that interruption to the flow of your presentation, and we look forward to hearing the rest of it now, Stewart. Thank you.
Yeah, not a worry in the world. Happy to help. So I'll just pull this back across. Okay. So is that working, Matt? Is that back again?
Yeah, that's working. Thank you so much.
Good. I haven't got long to go anyway, and this is really about shipping marks. So I guess there's been quite a lot of information flow recently about changes that are happening in the USA is the focus here. So as you know, the USA requires a unique shipping mark for all shipments of meat and meat export products or imports to the United States. And the shipping mark details are required to be included on the health certificates for identification and traceability. And to date, manual remarking of missing, incorrect, or illegible shipping marks at US point of entry has been possible within bonded warehouses or inspection houses. So I know that there's actually been, over the last, 18 months, there's been information passed to industry that as of the 30th of November this year, the department will no longer provide manual remarking services for shipping mark issues. And after the 30th of November, meat messaging will become the default system and protocol to address shipping mark discrepancies. The easiest ones being the illegible or missing. In terms of incorrect, there's still some negotiations going on. At the moment, we cannot correct those, but there is a strong belief that with the use of meat messaging, there will not be the chance for incorrect. And recent evidence or recent information to me is that 75% of beef to the US is actually going through with meat messaging at the moment. Electronic certification, eCert. I thought I'd introduce this. It's something I don't deal with a lot, but it's quite interesting. The COVID pandemic has really forced a change in how we trade. And in order to reduce physical contact or animate objects being passed, but still provide the same level of assurances, electronic certification came into vogue. And it was really an opportunity to identify any fraudulent activity quickly and more effectively. And currently, there is now paperless exchange for export of meat with the USA, Canada, Philippines, Japan, New Zealand, and South Korea. In terms of the EU, and the UK will be on board here too, a lot of work has actually been happening in the background because they're bringing in new certification requirements, and they're bringing in new regulations which hopefully will line up together. What it requires is what it will be a benefit is there's no longer a requirement for bilingual in many cases, the new information will be provided in English only, and with the system operating at the other end, it should be able to translate into the host language. In terms of meet notices, there really are only 2 this year that we've actually uploaded. The first one being the electronic meat transfer certificates, and the second, the gunshot wound incident reporting, kangaroo processing establishments headshots, and that one reports a lot of information on how to complete that report and how to submit that report, both from Tier 1 and Tier 2 establishments. And Matt, I think that brings an end to where I was. That's most of the information we have lately in the last 6 months anyway.
Yes, I suppose COVID has been a fair interrupter on the normal process of things going through, hasn't it? Certainly, I would have thought that more MTCs would have, or not MTCs, more meet notices will have come through in a normal period of time, I would have thought.
Yeah, well, look, we have another one in place at the moment. It's just going through. That should be out there once there's a bit more consultation on shipping marks and the use of shipping marks. And there is going to be a lot more material coming up on ELMA. There is a lot of documents currently in the mix for changes in regard to the new auditing policy. That's a big one. And so there'll be a lot of changes seen there with policy documents coming up on ELMA, but we're certainly going to keep everyone as fully informed as we can going forward with that for consistency. And we really are trying to simplify things as much as we can in terms of the policies, guidelines, and work instructions that we have available, both external facing and those that are internal facing as well, Matt.
All right. Well, we look forward to seeing all that work coming through, and hopefully we keep it simpler for industry, and so that we can really hit our straps and certainly do what we need to do. Amanda, I don't see that there are any questions that have come through.
That's correct, Matt. No, there hasn't been any questions come through, Stuart. So you've obviously answered everyone's thoughts.
And that's very good.
I hope so. It's pretty dry stuff, and I do apologise for that.
That's okay, and that's what happens to us people who work in the technical side. We're not bells and whistles, are we? But
not at all.
No, that's okay. If there are no questions, and if there's any that people think of in the meantime, we can certainly send those on and get an answer back. But again, Stuart, thank you very much for coming in and presenting what's been going on in the world of the department, and certainly and also thank you very much for having the interruption to the flow of your presentation. Yeah, I thank you very much for taking your time.
Oh, delighted to help. And look, any questions, and if I don't know the answers, I'll certainly do my best to find out from others who are involved. Yes,
certainly. Hopefully next year, in that sort of quarter 3 of the financial year, we might be able to be out and delivering this thing in person, face to face. It would be a nice thing if we get to that living with COVID normal thing sort of happens for us. And you know, we're lovely to see the people that we've been presenting to on the webinars face to face, and being able to put faces to names and the like. So I'm looking forward to that.
Yeah, I'm very much of that ilk. I do enjoy face to face, that's for sure.
Okay, so Amanda, I'll hand over to yourself to close things out if there's any more housekeeping at the end. Thank you.
Great, thanks everyone. Thanks Matt and Stuart for your presentation today. That was really informative, and I'm sure if there's any questions, we'll direct people directly to you, Stuart. Just want to do a shout out for next week's webinar. We're changing completely, and it's all around gamification and the potentials of gamification in the red meat industry. So for those that don't know what gamification is, you better join and watch. Stewart Shaw and the Advanced Manufacturing Core program has been doing some work and some gamification challenges. So it should be a very different webinar and a very interactive webinar. So you get the further information on that being sent out later this week. So thanks everyone for joining, and we look forward to seeing you on a future AMPC webinar.
Thank
Thanks,
you.
Amanda. Thank you. Bye.
Bye.